Search mnemonics are frameworks or templates used to break down a research question into distinct concepts that can be searched in a database. They are most useful when you need to find evidence to answer clinical questions, but can also be used to write them. Before starting your database search, break down the key ideas in your question using a mnemonic. There are many different types of search mnemonics, and each is used for a specific question type. Let's look at 3 of the most common mnemonics. PICO is commonly used to find randomized control trials for intervention questions. P stands for the population or problem. I is for intervention, a potential treatment for the population. C stands for comparison, which is often the gold standard treatment. O is for outcome, or the change you want to see in the population. Outcomes should be measurable and can be qualitative or quantitative. We can use PICO to break up the question, is echinacea more effective than a placebo in managing the common cold, into 4 concepts. The population or problem is common cold, because it is the patient's condition. Echinacea is the intervention, because it is how we want to treat the patient. We are comparing this treatment to a placebo, which acts as our comparison. The treatment will manage the common cold, which is the outcome. It's worth noting that if you're searching for an intervention question and it doesn't fit neatly into PICO, you may need to do some more work in refining your question. Another useful mnemonic is COCOPOP, which is used to find literature for prevalence and incidence questions. COCOPOP is particularly useful for scoping reviews, where your intervention, population, or outcome may be quite broad. The first CO stands for condition, the second is for context, and POP is for population. The clinical question, how common is claustrophobia in adult patients undergoing an MRI, would be put into COCOPOP like this. The patients experience or have claustrophobia, which is the condition. Patients are undergoing an MRI, which is the context. This question is about adult patients, which are the population. SPIDER is a mnemonic used to find syntheses of qualitative evidence. In this mnemonic, S stands for sample, PI stands for phenomenon of interest, D stands for design, E is for evaluation, and R is research type. Let's look at the question, what are the experiences of children in pain clinics? The sample is children because we're investigating their experiences. The phenomena of interest are pain clinics, or where the children are being treated. Patient experiences are collected using interviews, which is the design. We're looking at the children's experiences, which falls under evaluation, and patient experiences are qualitative research, which is our research type. After breaking down your question, use synonyms and subject headings to describe each concept in the mnemonic. Mnemonics are designed to provide structure to a search to make sure you include all your key concepts. If you need to adapt a mnemonic, try adding or removing concepts. Here's how you would add a location to SPIDER. And here's how you could alter PICO to find all possible outcomes. Or where there is no comparative treatment, or if there's a time frame to consider. Remember, these are just a few of the many search mnemonics available to you in health research. Contact your academic liaison librarian for further resources or guidance on using these tools.